Okay, so we were talking about the elbow joint, which is a ganglimus hinge joint. And the two joints that are involved in the elbow joint are the humeral ulnar joint and the radiohumeral joint. So the only two movements that are in the elbow joint are flexion, which is normal range of motion for that is 140 or 150 degrees, and then extension, which is 180 degrees or 0 degrees, and that's normal range of motion. The elbow joint is not very stable just because the capsule surrounding it is not very strong or big, and so the stability mostly comes from the ligaments. Now, the three main ligaments of the elbow joint are the ulnar collateral ligament, which is on the medial side, and that's so when patients have Tommy John surgery, that is the ligament that is torn. And then you have the radial collateral ligament, which is on the lateral side, and that is on the radial side. And then you have the annular ligament, which sits on top of the radial head and holds. For flexion, it's the biceps brachii, which is innervated by the musculocutaneous nerve. The origin for the long head is the supraglenoid tubercle of the scapula, and for the short head is the coracoid process of the scapula. They insert on the radial tuberosity. For the brachialis, it is innervated by the musculocutaneous nerve. The origin is anterior mid-humerus, and it inserts on the coronoid process of the ulna. For the muscles that extend the elbow, there's the triceps brachii, which is innervated by the radial nerve. The triceps brachii has three heads. The long head originates at the infraglenoid tubercle. The lateral head originates at the posterior proximal humerus, and the medial head originates at the posterior distal humerus. All three heads insert at the olecranon process of the ulna. Lastly, not shown on the model is the anconeus, which is also an extender of the elbow, and it originates at the lateral epicondyle of the humerus and inserts on the olecranon process.